Hello and welcome. My name is Dr. Morum. I've been injecting with Celebrity Skin and Laser Care in Vancouver, particularly West Vancouver and subsequently North Vancouver since 2008. We're going to be running a format where I'll be asked some questions and we'll start with the discussion regarding Botox. So both Botox and Dysport are botulinum toxins. They belong to the same group. There's a difference in the way that they have been approved. Dysport's been approved for use of moderate and severe wrinkles that occur in the middle of the forehead. It's called the glabellar region, commonly referred to as the number 11s. Botox has a broader area of approval. Quite honestly, most physicians do a lot of off-label use of both Dysport and Botox. Typically, Dysport tends to work a little quicker than Botox. Botox often taking between 1 week and 1 month to give you the effect, and the Dysport often starting within a few days. Both typically give you around 12 weeks of duration. Some people will experience longer duration with the different forms. The cost is quite variable. It really depends on what area is treated and how much of the product is administered. The Botox is sold per unit. Different muscles require different amounts of Botox. The easiest way to think of it is the larger the muscle mass and stronger the muscle, the greater the dose of Botox that would be required. Different people want different density of the blocks. And that's why we recommend people come in for a free consultation so that we can more closely address the concern and discuss the appropriate area of treatment. Botox works by weakening the ability of a muscle to contract. There is a series of muscles in the face that lift things up. There's a series of muscles in the face that pull things down. Wrinkles typically form at right angles to the movement of the muscle. So if the muscle contracts in this direction, the wrinkle is this way. If the muscle moves in this direction, the wrinkle is this way. The skin gets broken by the needle, so we immediately have a potential risk for infection. We have an entry point where bacteria can enter, so that's why we clean the skin prior to administering the injection. Once the injection goes in, it's a sharp-pointed needle and it can cut blood vessels. If we cut a blood vessel, the most common side effect we will see is a small bruise. You can also hit a muscle inadvertently and then you may end up with a side effect either from migration of the product that's administered or from injecting it directly into the wrong muscle. For example, in the forehead, if the Botox is injected too low, you can often get migration of the Botox down to affect a muscle which controls the eyelid, and this tends to be one of the more common side effects which causes lid lag and drooping of the eye. We call it ptosis. Botox typically starts working within a week, may take up to a month to see the full effect, and Botox typically is going to last around 3 months. Dysport typically starts working a little earlier, usually within 3 to 4 days we start to see some effect. The easiest way to think about Botox or Dysport is to think in terms of muscle fibers in a muscle. So the easiest way I visualize it is I try to pretend, say for example, we have 5 muscle fibers in a muscle. If I knock 1 muscle fiber out, I've got weaker movement but still got movement. If I knock 2 fibers out, I've got even weaker movement, but I still have movement. If I knock out 3 fibers, it's typically 6 to 8 weeks before I get back movement. If I knock out 4 fibers, I'm typically getting back to movement in around 12 weeks. And if I do a dense block, it's often approximately 16 weeks in order for me to get back to movement. Typically, people will come in and get a Botox injection. The injection is injected usually in the face, just under the skin. Often we will see a small bleb or a little bump that raises up. We might see a little bit of redness. Typically takes 5 to 15 minutes for that to settle. Patients will often come in and then leave and carry on with their day as normal. Botox is used very successfully at controlling excessive sweating. We call this hyperhidrosis. We typically administer 100 units of Botox into each armpit, and most women who receive the injection have a very high approval rating of this. It can also be used to control excessive sweating in the hands. It tends to be a painful procedure and requires topical analgesia. Botox has been used very successfully to treat migraine headaches. The protocol that we follow is known as the preempt protocol. It typically involves anything between 150 and 195 units of Botox. Effects vary from patient to patient, and they sometimes require some customization of the injection pattern. We typically aim for 12 weeks duration of the Botox. The easiest way to think of this is based on a graph. If we look at it, we have an x-axis and a y-axis. Our x-axis is time, our y-axis is dose. The higher we go up on the dose, the further out we push the time. If you're getting 6 to 8 weeks duration on the Botox, we typically need to increase the dose, and our target usually is approximately 12 weeks. It all depends on the insurance company. Some insurance companies will have different requirements. Some are much easier to get approval than others. You can also sometimes get approval through aftercare, though this requires a submission by your physician. It then gets reviewed by a committee, and if approved, the Botox will be covered through the provincial plan or through the third-party insurance. Most clinics then charge an injection fee which is not covered through the insurance. We don't recommend that pregnant women do Botox during pregnancy. Breastfeeding is most likely safe. We don't have any long-term studies that have been done comparing groups that have received Botox and groups that have not received Botox. Everybody tends to give Botox to breastfeeding women. It's bound to the muscle. There's very little systemic spread. It's unlikely that it gets into the breast milk. Yes, so we actually do administer Botox or other neurotoxins at the same time as a wide variety of different cosmetic procedures, including fillers, PRP, laser energy devices, and most of the patients tolerate these without any concern.